How to care for a child with diarrhea. Diarrhea generally indicates either a mild or severe illness and is not moderate. Your assessment of the child will help you decide which one it is. Let's review what actions you should take to care for a child with each of these illnesses. For a reminder of how to assess a child with diarrhea, take a look at another video in this module. Remember that the illness can change over time, and a child may get worse quickly. So, reassess the child in a follow-up visit and educate the family on the danger signs to look out for. Your danger signs job aid will help you identify these danger signs quickly so that you can refer the child immediately to a health facility. Diarrhea, which is described as a couple of small loose stools for a few days, is usually a sign of a mild illness, as most diarrhea goes away after 3 to 4 days. A child has a mild illness if they have had diarrhea for less than 14 days, do not have enough watery stools that they become severely dehydrated, have no blood in their stools, and have no other danger signs. Explain to the caregiver how to treat the child at home. The most important treatment for diarrhea is to ensure that the child stays well hydrated by getting enough liquids. This normally means giving the child an oral rehydration salts or ORS solution. Show the caregiver how to make an ORS solution. If you do not have ORS, you can show them how to mix a sugar salt solution or SSS. Then, help them give the solution to the child. Refer to the video and job aid for step-by-step instructions on how to do this. Zinc is also an important treatment for diarrhea as it reduces the number of days of symptoms, how often the diarrhea occurs, how severe it is, the risk of long-lasting diarrhea, the risk of illness for up to 3 months. Zinc also helps increase the child's appetite. Show the caregiver how to give the child the first dose of zinc by dissolving the correct dosage of the tablet in a spoon with breast milk or safe, clean drinking water. If the child spits out the zinc, tell the caregiver to try to give the child another dose. Give the caregiver the rest of the zinc tablets to continue giving the child every day until all the tablets are finished. Tell the caregiver to continue giving the zinc, even if the diarrhea stops, as this can help prevent diarrhea for up to 3 months. Advise the caregiver to give the child more liquids to drink to replace the lost fluids. ORS solution should be given with as much breast milk or other liquids as the child is willing to take. Lastly, tell the caregiver to continue feeding the child food if the child is eating complementary foods or is not breastfeeding. They should try foods that are easy to eat, like maize meal, dry bread, rice, and fruit. Avoid foods like dairy and fatty foods until the child feels better. Because severe diarrhea can cause malnourishment, once the child is better, the caregiver should give foods with extra vitamins and minerals and feed them more often. Ask to see the child again in a few days or sooner if the child gets sicker. Educate the family on the danger signs to look out for and ensure they know that these mean that the child needs to go to a health facility urgently. Now, let's discuss what indicates a severe illness. Diarrhea that continues for 14 days or more. Diarrhea with signs and symptoms of severe dehydration. Diarrhea with blood in the stool, or with any other danger sign, indicates a severe illness. In all these situations, you need to refer the child urgently to a health facility. If the child can drink, begin giving ORS solution or SSS as much as the child will take, until leaving for the health facility. Give the caregiver extra solution to continue giving the child and advise the mother to continue breastfeeding on the way to the health facility. Also, give the child the first dose of zinc. For a reminder of the signs and symptoms and next steps, take a look at the job aid. Remember, if the child has any danger signs, they should be referred to a health facility urgently.